Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. In this edition, we're going to continue our series. If you saw on Nurses Week, I did a video called the 10 medications you should know to be a postpartum nurse, something along those lines. I'm actually going to do now nursery. So we're going to do only 4 medications that you should know to be a Well Baby Nursery nurse. If you want to see what I'm talking about, stay tuned. Welcome back. My name is Dr. Marita P. I'm a registered nurse, been a nurse for almost 17 years. OB/GYN Well Baby Nursery is my specialty. I am a nurse educator. I teach at HBCU. We're on break at the moment, and I am doctorally prepared. So what we're going to do is I'm going to talk to you about the 4 medications. There's not many because babies, if they're well, they're well. If they're sick, they go to NICU. And that's another whole topic right there, and that's not my specialty. So we'll not be discussing meds for babies who are sick. This is only well babies. These are only medications that they all routinely get for the most part when they are in nursery. So we're only going to discuss 4 medications because that's all I can think of that they actually get routinely, again, for a well baby. All right, so let's go ahead and jump right on into it. This video won't be that long. I'm going to go over the 4 medications and in general what they are for. You will need to do the research to know more about them. I'm not here to go into all of that, but I just want to kind of tell you the 4 medications that you need to know about if you're going to be a nursery nurse. So medication number 1 is EES or erythromycin. It is something that we actually put in the baby's eyes upon delivery. Now, you will have some moms who will opt not to get the erythromycin because that's just what they've chose to do. But for the most part, they will have to come in saying that they do not want their baby to have the EES or erythromycin. What it is an antibiotic for the eye. And what it is used to treat is the potential bacterial infections that could be in the eye from passing through the birth canal. That's the primary reason. Now, C-section babies get it too, but the primary reason as to why you're going to do it is because baby's passing through the birth canal, and we want to make sure that any type of bacterial infections that could acquire while passing through the birth canal, we go ahead and treat. So that's what it's for. Typically, all babies get it, whether a C-section or vaginal delivery, they still get it for the most part. If your hospital does something different, comment that below. But they all get it unless mom says they don't want them to have it. And again, that's something that she would have to say that up front. All the hospitals I have been to, they don't ask if you want the erythromycin or not. They just give it. So you have to come in already well versed on wanting your child or not wanting your child to have it if that's the case. So erythromycin. Number 2 is Hep B. Now you all know that Hep B is part of the vaccination series. You get 3 Hep B vaccines. You get 1 at birth, you get 1 at 2 months, and then you get 1 at 4 or 6 months, depending on your vaccination scheduling. However, some patients or some parents will elect to delay the first shot until they either go to the office at 2 weeks or maybe have their first shot at 1 month and do 1 at 2 months. Some people choose to do that. That's something that it has to be consented for. So that's something I actually walk into the patient's room with a consent that says, do you want your baby to have the Hep B vaccine? And then they will sign to say, yes, they do want the baby to have the vaccine. So that is something, like I said, that they will definitely be consenting for. You don't get that on its own. We would like to assume that everybody gets the Hep B vaccine, but keep in mind we do have people who are not going to vaccinate their baby, or they're going to delay vaccinations for whatever reason. So if that's the case, then they will not get their vaccine at the hospital. Now, I do want to say NICU babies are on a delayed schedule as well. If you are a NICU baby, that means you are sick for some reason. We are not giving you those we're not giving those vaccinations when you first are admitted to NICU. You would get those vaccinations typically upon discharge from NICU. So later, so your schedule will be delayed anyway, depending on why you're in the NICU in the first place. Now, sometimes babies are well or start off well, and they've already gotten everything, and then they end up sick for some reason. Maybe they can't maintain their blood sugars or maintain their temperature, so they end up having to go to NICU. That's something different. I'm speaking of babies who they came out of the womb and they had to go straight to NICU, those babies will not get the Hep B vaccinations until they are well from their situation. But all other babies will get the Hep B vaccination upon consent from the parents. The third one I want to talk about is vitamin K. So vitamin K is needed for clotting properties, okay? Babies who do you need vitamin K? Yes. And this is another one that you're automatically going to get. I have had patients or parents come in and say that they do not want their babies to have vitamin K. And that is not good. You want your baby to have vitamin K. It doesn't, the babies don't have the ability, they don't have enough of vitamin K in their system. They're not born with enough. So they have to have vitamin K injection to help with the clotting properties. If they don't have that, there's been babies who come back with bleeding on the brain and things like that. So it is something they need to have. But yes, we've had people who would say something like, that they are wanting, they don't want the baby to have vitamin K injection. So, they have to, I don't know what happens in terms of what paperwork has to be signed when they don't want that. I haven't had that happen personally, but I have heard some stories at other local hospitals that has happened, and the baby has ended up in the hospital in the NICU or the PICU for bleeding of the brain because they didn't get their vitamin K injection. So yes, you want the baby to have that. Another one I'm going to put on here is called Sweeties or sucrose water. Now, Sweeties, sucrose water is a medication that we typically use to help soothe a baby. The few times that I have known that we actually use sugar water, Sweeties, sucrose water to soothe the baby specifically is when the baby's getting circumcised. So a male baby who's getting circumcised, who he is in pain. And so they use that as a pain management type thing. Something that helps with pain and something that helps soothe the baby is called Sweeties or sugar water. So that's something you want to know. And then I have seen babies who, to kind of calm them when they are withdrawing. So when we do a NAS baby, a neonatal abstinence syndrome baby, who we're scoring them, they're still on the well baby side for now, but they're going to go to NICU maybe. We sometimes have to soothe them, give them something to soothe them when it comes to that as well. So those are the 4 medications that I want to say that you really need to know for, and that is considered to be a medication. It's water basically, but it is used as a medication. So yes, you have to be able to, that's why I said it's a medication for the last one, for the Sweeties. It is a medication or used as a medication. Every baby does not get Sweeties. So I want you to know that as to why it is called that, and that we do give it on a basis of need, not, oh, let's give the baby some Sweeties or some sugar water. We don't do that. So hopefully those 4 medications have been helpful for you if you're going to work Well Baby Nursery. And honestly, if you're going to work postpartum, you might as well know nursery, and nursery might as well know postpartum. They kind of go hand in hand. I will link that video to this video so that you can see that video if you have not seen the medications you should know for postpartum. And that is pretty much it. So follow me on IG if you have not already. Follow me on TikTok if you have not already. Ask your questions in the comment section below. And until the next time, you all take care. Bye-bye.